The transverse section of the spine is formed by 5 ridges of the lower back, extended between the ribs and pelvis. Transverse stenosis is caused by a sounding of the spinal canal, which causes compression of the nerves that pass through the transverse canal and innervate the lower ends, legs. In most cases, degenerative changes occur in patients aged 60 years and older, although in some cases they occur in younger people, due to congenital characteristics. The sound of the spinal canal will last for many years or even a decade. The discs become less elastic with the eyelid, which can lead to loss of their height and can cause a pinched disc at the spinal canal. Symptoms of transverse stenosis may include pain, weakness or pain in the legs or buttocks, spasms in the casts during an hour of walking, so that parts of the short ankles are pulled out, bill, which gives one or the other an insult to the stitch and leg. In single episodes, disruption of the ruchal function of the legs, disruption of the normal function of the intestine or secundum. It can change when leaning forward, sitting or lying down. Degenerative spondylolisthesis, straining of one spine rather than another, may result from osteoarthritis of the facet joints. Most often it is connected with displacements of L4 ridge or L5 shodo-Kryzhev. Depending on whether the vein is treated with either non-surgical, conservative, or surgical methods, such as transverse spinal stenosis. Degenerative scoliosis most often occurs in the lower back and most often affects people aged 65 years or older. Back pain associated with degenerative scoliosis begins with physical activity. The curvature of the ridge as a result of this form of scoliosis is often quite insignificant. Surgery may be indicated if non-surgical approaches do not help to relieve the pain associated with this pathology. The diagnosis is made by a neurosurgeon by analyzing the history of illness, symptoms, and by reviewing the results of additional diagnostic methods. Various imaging methods include X-ray computer tomography, MRI, myelography, non-surgical treatment taking time, liking, correct positioning, stretching, and rightly can help many patients with acute pain. There may also be indications for vaginal control. Nicotine supplementation and therapy aimed at improving the cysts. To relieve swelling and pain, anti-inflammatory drugs are used, and to relieve pain, analgesics are prescribed. Most pain can be treated with over-the-counter pain relievers, but if it is severe or persistent, prescription medications may be needed. To relieve swelling, epidural injections can be used. Physiotherapy and/or a complex of special treatments can stabilize and strengthen the spine, improve elasticity and flexibility. Therapy can help patients return to a normal way of living. It is recommended to use up to 6 types of therapy. Surgical treatment: the doctor may recommend surgery, since non-surgical treatment will not improve the size of the skin. There are different types of spine surgeries available, and depending on the specific situation, the neurosurgeon can help determine which procedure may be appropriate for a particular patient. As with any operation, the risks for the patient include age, general health and other factors, which are taken into account later. The patient can be considered a candidate for surgery if pain in the back and legs interferes with normal activity or depletes life, progressive neurological disorders develop, weakness in the legs, sagging feet, numbness in the ends, destruction of the normal functioning of the intestine and/or the mucor, difficulty when standing or walking. The final state of a healthy patient allows for surgical treatment. There are a number of different surgical procedures that can be performed, depending on the severity of the illness. In some patients, spinal instability necessitates spinal fusion. This is indicated before the operation. Spondylolisthesis is an operation that involves fixation of 2 or more spines. Spinal fusion can help improve and stabilize the spine and thereby relieve severe and chronic back pain.